Do you think your forehead looks more like a 5-head? Well, if that's the case, there's a surgery that a lot of people don't know about. Watch this video to learn more about a forehead reduction surgery. Hi, my name is Patel. I'm a facial plastic surgeon in Beverly Hills, and one of the surgeries I perform very often is called a forehead reduction. So what is this surgery? It's unique and not a lot of people do it, but it's a surgery that can make you have a smaller, shorter forehead. Sometimes people can have a forehead that's a little bit longer. You can call it a 5-head if you want. And some people can think it's a receding hairline when it actually isn't. And this can make you feel conscious about it. Now, before you go into looking into the surgery, you should know what's a normal measurement. So we have something called the rule of thirds when we do an aesthetic analysis, where your hairline to your eyebrows should be equidistant to the distance from your eyebrows to the base of your nose and the base of your nose to your chin. While this isn't a guaranteed rule, having this ratio is more important than having an actual distance. When it comes to actual distance, we're looking at somewhere between 6 to 8 centimeters from your eyebrows or where your brows start to where your hairline is. Of course, it can vary. In men, it's more natural to have a U-shaped forehead with a widow's peak. In women, you want it a little bit rounder. Now, if this is something where you're self-conscious about it and you're interested in improving it, you have options, and forehead reduction is one of them. But before we talk about forehead reduction, you got to talk about the more classic option, which is a hair transplant. So a hair transplant works by taking hairs from the back and sides of your head and putting them up front. Now, it's very different surgery than a forehead reduction. It has its benefits, but it also has its downsides. The biggest downside is going to be cost, because with a hair transplant, we can get maximum of about 2,000 to 3,000 grafts at a time. It can lower your hairline about 1 to 1.5 centimeters. And if you try to go further than that, it's going to look unnatural because we're taking those same hairs and spreading them out, giving you a more doll-like appearance. If what you want is more than that, your best option is going to be a forehead reduction. Now, simply put, a forehead reduction is a surgery in which we're removing the excess skin and sliding the hairline down and putting stitches to create a new hairline. There's one obvious downside, and that's going to be a scar. As a surgeon, it's my job to make that scar look as appropriate as possible, and we have various tools. So the three main tools we're going to use are going to be things that increase the laxity or how much we can move the forehead. The first one is going to be called ghaleotomies. This is essentially when we've made our incision, and on the undersurface of the scalp from behind, we're able to make little cuts to loosen it and allow it to pull forward more. The second is going to be a little bit more drastic option that's called a scalp expander. This is not something I like doing. This is not something I like telling people that they need to do, but sometimes it's the reality. If you need enough of an advancement, the only way you can get it is going to be by putting in a scalp expander. Now, what's a scalp expander? It's a surgery in which we're taking a rubber balloon and implanting it underneath the skin and then slowly expanding it with saline on a weekly basis over the course of about 6 to 8 weeks. This would give you a large bump on your forehead, which then stretches out the skin slowly. And once we take that out and slide it forward, everything will pull forward nicely. Now, last but not least, we have something called an endotine. This is a tool where we're able to tack down the skin forward by using something that's similar to a dissolving carpet tack and attach it to your bone. This in reverse holds the tension. Tension is the key. As much as I have a lot of strength, I can only pull your hairline down so far, because the more I'm pulling it, the more tension there is, and the more tension, the worse your scar. The last trick I have is a simple hair transplant. Putting in something like 1,000 grafts after your surgery right around, in front of and behind the scar will minimize it to make it near invisible. And that makes the surgery a win-win situation. Now, with a forehead reduction, I can get on average about 2.5 centimeters of distance. There's a range depending on your laxity from anywhere from 2 centimeters to 3 centimeters, but the average is 2.5. The way I see your laxity is simply by having you go like this and seeing how mobile it is. I also need to assess what your hair is like. The best candidate is someone who has a normal density and thickness of hair at their hairline. It's just a higher forehead. If you are losing hair, that is a good reason to not do the surgery, because progressive hair loss will make that scar more and more visible. And for example, if you have male pattern baldness and you lose your hair all the way to the back, even though we lowered the hairline, your new scar will now be visible at the very front. The recovery from the surgery is fairly simple. You're gonna go home. I generally do the surgery with you asleep or under IV sedation. It's not something that would be very comfortable to do awake. Once you're done with surgery, you have a wrap, you're gonna have some swelling, bruising, and your stitches will be visible for a couple of days, and you can style around it. The stitches generally come out at about the 1 week mark. You go home the same day after surgery. Your pain is minimal. After the stitch is out, the main downsides, other than being patient for the healing and patient until you might want to get hair transplants, is gonna be that the back of your scalp is gonna be numb, all behind the hairline. The cost of the surgery varies anywhere from $5,000 to $20,000. It depends on where you go and how much expertise your surgeon has, and most importantly, how much is involved in getting you the results that you're looking for. If this is something you're interested in, feel free to reach out to our office to schedule a consultation. Look forward to meeting you guys soon.